Thank you very much for the introduction, and thank you very much for having me today. I'm here to talk about UMore, our approach to being able to support users and their mental health through our app, and also the research that the research platform we have developed through the app is capable of helping with. So to start with, we'll understand the problem. Since the onset of COVID, mental health has become increasingly more important, with 1 in 5 people around the globe expected to experience a mental health challenge every year. But there is a long time between the start of symptom onset and when treatment usually starts to occur. And 70% of individuals will never get the care that they need. So the mission that we have in UMore is to try and support those at the very early stages to be able to better understand their own mental health and start to receive some preventative support in order to support them along that journey. So we want to help people like Leela. Leela, we believe, can be her own best advocate in the early stages of being able to support her own mental health. And by screening and tracking, we think Leela can understand and start to learn what really works for her own mental health. So when it comes to UMore, we have 3 pillars that help us achieve this. We measure mental health, we provide options for self-care, and then we help users track their progress so that they can understand what is working for them and what isn't. So how does it start? Well, to begin with, we start with data. We want to understand as much as possible from the user, their behaviors, and their mental health status. So we use a combination of passive data collection, but also of physical self-reported inputs, where we can understand about the user's stress, anxiety, depression, and also mood through ecological momentary assessment and psychometric surveys. Then we provide a unique score for the user. We use this as an index of the outcomes of these psychometric indices. And we report this back to the user so that they can have a sense of understanding of where they are coming from. We then provide a series of targeted exercises to support the user and their mental health outcomes. And then we measure the impact of these with a continuous feedback loop and a view of how this changes the score in order to understand how best to support the user. And this is all coming from an evidence-based design of implementation. So as I mentioned, we focus on psychometrics. We look at stress, depression, anxiety, but also use a variety of phone inputs and mood to build up a holistic picture of what exactly the user may be going through. And then we also provide an evidence-based approach to self-care. So when it comes to the targeted exercises that we provide our users, we make sure that we provide a range of different evidence-based self-care options, because we understand that there is no one-size-fits-all, and the preferences across users is certainly going to differ. So we use a variety of inputs, not just from cognitive behavioral therapy, but also positive psychology interventions, behavioral sleep hygiene, mindfulness, and many more. And this is built off the theory of self-quantification and activity theory. We believe that through the robust design of an app that inspires and motivates users to engage with it and to be able to track and have an engaged role within their healthcare journey, they become activated patients. And this patient activation is going to lead the user to make the best possible health behavioral changes that is going to be supporting them through their mental health journey. And the outcome of this is motivation. And this is what our design efforts are moving towards, so that the patients can become the best possible versions of themselves in the early stages of mental health discovery. And we have some great signs of validated usage and adoption. So far, we have 18,000 registered users, and of which 80% of them sign up through the activation rate that we have and are onboarded onto the app, which is a very high percentage rate of onboarding within the industry. But not only that, we have a 90% average positive feedback rate across the self-care activities that we have within the application as well, which shows some early signs of promise through its development. But also, we think it's very important that UMore can be used as a tool for psychological research, because there is a lot of learning potential that we can take from a platform such as this that we've built. So we can collect a variety of data points relevant to 2 main things. We can understand changes to user mental health outcomes over time across cohorts at large, but also we can understand the qualitative and quantitatively speaking, the impact of particular interventions that we implement in the app. I mentioned that we have a range of of psychological self-care exercises, and each one can be tailored for a particular purpose. So we can understand for a particular cohort of users, is, for example, a mindfulness activity for stress the thing which is most helpful for them? Or do they perhaps prefer a CBT type of text-based activity for this particular age group? So we can start to understand exactly what is helpful. And we can do this through the UMore sign-up process. So by collecting the demographic data, the psychometric data, and an understanding of which self-care activities the user is engaging with, and also what they choose to interact with through the dashboard, we can build up a picture of exactly what user behavior looks like for a particular cohort. In terms of what we're measuring, I mentioned that we look at demographics and also psychometrics, but we can understand user behaviors, such as which symptoms are the ones that are most expressed, the time of day that users will monitor their mental well-being, which mental health improvements, which mental health interventions can lead to the greatest improvements, and also how users give us feedback in terms of a qualitative text box that we provided them an option to do so in terms of the evidence-based mental health self-care interventions that they engage with. And the impact of this is going to help us provide anonymized tailored data, but as I mentioned, also being able to test for specific cohorts in terms of the research that we may be able to support with. Now, we have an ongoing of research partnerships and academic studies where we are currently engaging with exactly such research. And in terms of exactly how the research may be useful, we hope that through the UMore platform, we'd be able to provide access to a variation of different mental health data sets for different cohorts, as I mentioned, for different demographics, but also access to a wide population of UMore users to be able to support with such research and the ability to experiment without having to worry too much about participant recruitment, while also testing for particular self-care activities to see how they work. Of course, all the data that we have is anonymized for such purposes, and users have provided their consent for the utilization of such anonymous data. But it's for this reason that UMore would love to support academics and clinicians with their work regarding mental health research to understand how we can best help individuals, no matter where they are in the world and what demographic they belong to. So my name is Alejandro. Again, thank you so much for listening to me today. And if you would like to get in touch with myself or learn more about UMore, my email is on the screen right now. Thank you very much for having me here today.